grow that mustache. I know my kids try to do it. It looks pretty funny. You've got we had breast cancer awareness last month. April is just a generic talking about cancer. So spotlighting cancer, your benefits plan. So as Tari mentioned, making sure you have that drug coverage, STD and LTD again for people who need to be off through their treatment. Depending on your industry, you may have hazards in the workplace. So having that risk assessment done in your workplace around workplace material hazards. Medical second opinion services, I think, again, a service that's really underutilized. I personally have used it actually when I had skin cancer diagnosis in terms of what are my options instead of having a huge hunk taken out of my face, what could we look at doing? So it was a great service at that time. Critical illness, so we have Allstate out there at our vendor booth talking about critical illness. You talked about the cost at $33,000 for your spend if you have that. Some people want to just not have the pressure of paying their mortgage payments, or they want to go out of country for some sort of experimental treatment or clinical trials. So having access to that lump sum of money can be just a huge support for somebody going through cancer. Obviously, EFAP, we talked about connection with mental health. CarePath, Cancer Navigation Service, excellent company for your employees in terms of navigating if they do want to, if there is a clinical trial, where is it, how can they get into it, what access to coverage do they have through the provincial plan if things aren't fully covered under their private plan. And those flexible work arrangements and accommodations for people that are going through chemotherapy. Some people want to work in between. And so if you can allow them that because they can kind of feel like they're not focused just on their cancer and their recovery, having that flexibility can go a long way.